2 weeks is enough for any normal back pain or neck pain to go away. Even if a minute there's a stoppage of the blood supply to the brain, 1.9 million of your brain cells will die. So it's been more than 14 years now I've been cycling regularly.
Wow.
And touch wood, there have been no back pains or neck pains since I started cycling. In the last 6 months, I've operated a few 95-year-olds.
Wow.
2 years back, I operated one 103-year-old freedom fighter.
Wow. I'm hearing of kids needing neurosurgery. Why does that even happen? Hello and welcome back to the Good Doctors podcast by Zynova Shalby Hospital, where we sit down with some of the finest medical experts to talk about the questions you and I have. I'm your host Jagu, and today's conversation is all about our brain and spine, the command centers of our body, but also the ones that give us headaches, back pain, and sometimes a lot of unnecessary fear. So instead of Googling symptoms at 2 a.m., let's get answers straight from Dr. Vishwanathan Iyer. He's a neurosurgeon. Stay tuned because we're going to break down common problems, big myths, and practical tips you can actually use in your everyday life. Dr. Iyer, thank you so much for doing this. Let's start simple. The most common kinds of patients that you see, I want to get a sense of who walks into your OPD with what symptom.
Generally, in our OPD, the commonest symptoms are, of course, headaches.
Yes.
Okay. Occasionally, we do get vague symptoms like lack of sleep,
Okay.
tiredness, fatigue.
Hmm.
And because we are a specialty tertiary center, we do get directly defined cases of brain tumors and so.
Okay. Fair enough. So I want to come to this headaches bit because we're going down the brain and spine road. The assessment is that I will get a headache because of stress, anxiety, dehydration. At what point do I say, okay, this is more than that? What am I looking for?
I think you're right about the fact, Jagu, that everybody will get a headache sometime in life. It's one of the most commonest problems to have. You cannot ignore a headache if it is unusual for you.
Okay.
So basically, you know your body.
Okay.
So you must decide what is unusual headache for you. Any sudden severe headache which has never happened before to you is extremely important and you must seek attention.
So is that an intensity thing or like
It is
different
like
side of the head
it's like
thing?
out of the
or-
blue, like a bomb in the brain.
Okay.
Okay, sudden severe headache
Okay.
definitely needs immediate attention.
But over and over again or?
Once,
Oh.
even once, a sudden out of the blue, never before headache
Okay.
needs attention.
Okay. Fair
Okay.
enough.
And third, any headache which is with symptoms like vomiting, giddiness, some tingling in your hands, something more than headache.
Okay, that
Again,
is sounding
needs
like
attention.
hangover. No? No, but fair enough. I don't want to belittle this. I'm looking for a headache combined with nausea, vomiting. These are indicators that something beyond the pale is wrong.
Yes.
Okay, fair enough. Now, separately, just like we deal with headaches, there is back and neck pain.
Huge.
Now, sometimes this is lifestyle or let me say corporate desk job, laptop, computer, all of that. And as one gets older, it's like it happens sooner. You wake up with a creaky back or you get up from your chair with a creaky back. Everybody deals with this. Now over here, what is the point where I'm like, okay, I should seek medical attention?
It is very interesting that you raise this back pain and neck pain kind of topic, Jagu, because probably in my clinic today, more than 50% of the patients I see are patients coming in with neck pains and back pains.
Okay.
And you'll be surprised to see that most of them are below 45. Most of them.
Fair.
So I don't think age is anything directly related to that. And I feel the contributory factor is the sedentary sitting in the office the whole day kind of structure.
Sure.
So like you asked me, which are the back pains and neck pains to be really thought about?
Yes.
Or what are the red flags in back pain and neck pain? So again, a back pain or a neck pain which doesn't go away in 2 weeks of regular medical care. Second, a back pain or a neck pain associated with tingling, sensory problem or numbness or weakness in the hand or leg. Any back pain, neck pain with a difficulty in passing urine, that becomes a very important problem.
Oh.
So you must
Okay.
remember 2 weeks is enough for any normal back pain or neck pain to go away.
This is by self-medication
Either by
or...
self, by some rest, or by
Okay.
local doctor giving you some painkillers relief,
Okay.
physiotherapy. So anything which does not go away in 2 weeks,
Hmm.
it means it is important enough to take attention.
So sometimes, and I'm speaking almost from personal experience, sometimes it's not a standardized 2 weeks. I'm dealing with pain. It'll come, go, come, go, come, go. Is that also a red flag?
See, coming going pain is more likely to be not so important.
Okay.
Okay. But if a pain is disturbing your sleep, that again is a huge red flag.
Got it.
So normally when you're asleep, your muscles are, relaxed. They are in a very, if I may say so, a chill mode. If that gives you back pain, then that means there is something probably serious underneath.
Fair. Something that is, well, has improved our lives, but is also sometimes called the bane of our existence, mobile phones. Now, a computer screen, yes, there's a posture issue, etc., but it's not moving. It's right there in front of you. With a mobile phone, we're doing this. And there are literally those memes, those diagrams that have come out about, you've probably seen these dozens of times, where the amount of the angle that you bend your neck, that much more weight your spine is taking. You're familiar with that diagram? What is the medical truth to that? That the more I bend, the more weight my neck and spine are taking.
Obviously, any posture which is not so normal physiological, if you maintain it for too many hours in a day, it is going to create a problem in your musculature and your ligaments, and that will maybe push you towards a spinal degeneration earlier in life.
Okay.
So a neck injury or a neck problem because of chronic mobile usage and a low back problem because of not ergonomic usage of laptop is the preliminary reason why many patients are coming now with these symptoms.
Fair.
So what I always tell my patients is that, see, if you're working on a computer, if you have a corporate job, you can't quit your job and go home. So all of us have to deal with our jobs. Only thing you need to know how. So there are, of course, beautiful ergonomic chairs available now, ergonomic desks which are available. Your screen, the size of your screen can be larger for you if you want to use it for 8 hours in a day. Instead of using the phone in your hand, you can use earphones if you're on the chatting or the calling mode every day. So there are ways to prevent it despite your lifestyle.
Okay.
So I don't say that, blaming the corporate lifestyle is a getaway kind of a thing.
Fair.
Okay. And the most important thing which every guy sitting on the computer should do is to get up every hour, take a small walk, say hello to a couple of friends, come back again.
Yeah.
So don't sit on your job chair for more than an hour.
Fair enough.
Taking a break intermittently is enough to deal you with a good long-term back efficacy.
So even a 2-minute walk around the office
stroll. I
is
think
fine.
just a small stroll. You can just meet some friends and the colleagues. Just say hello to them. That should be enough.
Fair enough. I'm going to come now to not a physical thing, but so many young people complain, I forget things easily. And sometimes literally it happens in conversation. There'll be a full stop while somebody is trying to recollect something that they said. Colloquially, I want to say that's happening more now than it was happening 10, 15 years ago. But colloquially, I have no actual evidence.
True.
How much of this is just a lifestyle thing that we're focusing on too many things, that we're distracted too easily? And at what point does one have to say, this is becoming too much? Is it a neurological problem?
It's a beautiful question, Jagu. Because I think most of the times young patients or other young people coming to me in my clinic with memory issues are more to do with their multitasking.
Yes.
So whenever you want to do 2-3 things in at one time, definitely you will be missing out something, you will forget something.
Sure.
Okay. And the anxiety that you are forgetting will make you forget more.
Oh,
So,
it's a loop.
It's a loop.
Okay.
I think if you're handling 3 things and you suddenly say, okay, I don't remember. And then you feel, okay, oh God, I'm not remembering. So then it becomes like anxiety about that. And then it keeps on recurring.
Okay.
So most often in younger people with these sort of memory issues, it is to do with multitasking, lack of sleep, and trying to, wake up in the morning and do everything in that 18 hours of awake time.
Yes.
And we need to investigate only if a memory problem is affecting their activities of daily life.
Fair.
Like to the point of, oh, I don't remember where's my car key every day. Or
Oh, every day.
Yeah.
Okay.
So I think once in a while forgetting we all do.
Yeah.
It really doesn't need much of bothering except probably a little lifestyle tweak here and there.
Just calm down, slow down a little bit.
Precisely. And that is the most difficult in today's world, I think.
And there is no cutoff age to actually start that.
Yeah. So when you keep on talking about young, I really don't know what young means.
Okay. So look, that's interesting. What now is the definition of young from the point of your OPD? Because we hear, and it's very unfortunate, heart diseases culminating sometimes in death. And,
Yeah.
those stories go around, people in their 40s, even in their 30s. Um, Cancer patients getting younger and younger. I heard this stat from a doctor, as a matter of fact, that every decade that passes, the age of someone getting cancer drops by a decade. So literally a decade ago, it was 40s, which was shocking enough. This decade, people in their 30s are walking into clinics and being diagnosed with cancer. The brain and spine area, therefore, now what is young?
If you see anything below 45, we call it young
Okay.
patient. Okay.
I missed that boat.
Yeah.
Okay.
Above 45 to 60 is still middle age for us.
Okay.
And senior or other aged patient is reserved for 65 up.
Okay.
Yeah, because with good life expectancy increasing in India,
Yes.
and people are working till 60, 65 very actively.
Hmm.
So I think the definition of young and middle and old also should probably be changed.
Fair enough. No, and I also asked this from the context of, would it be fair to say that depending on age or even category, young, middle age, senior citizen, treatments would change?
Treatment normally changes depending upon the physiological age of the patient.
Okay.
So somebody may be 75, but if he's a fit man and he's doing all his activities without any medical other problems, then he deserves all the medical and surgical care he needs.
Sure.
Similarly, somebody who's like maybe even 65 with a lot of diabetes or hypertension, not very active in life, we may need to downplay our treatment. So
I
it is
understand.
more on physiological age rather than chronological age.
Okay. Let me shift this a little bit. I want to get into surgeries, misconceptions about surgeries. Let me set a base for this. What are the most common brain and spine surgeries that you end up doing?
In brain, normally a lot of our work is emergency work.
I see.
So, accident cases,
Ah.
fall from heights, and then comes the stroke, which is a big basket now. Then there are bleeds in the brain. So these are the emergency brain cases we operate.
Okay.
The planned brain cases are more to do with tumors, and they may be either benign or malignant.
Okay.
We also do a lot of spine cases, and spine is generally what we operate is mostly degenerative spine
Okay.
or aging of the spine, if you may call it,
Okay.
like slip disc, which is the commonly known problem, or treatment and surgeries for back pains.
Okay. But as far as the treatment is concerned, surgery would literally be the last thing one would consider, right? There's multiple other things that one can do to get to that point. Is that fair to say?
Yeah. For degenerative back problems or neck problems, always a good medical treatment is tried. So the medical treatment may involve medications for some time, lifestyle modifications, posture corrections, core strengthening, physiotherapy. And only when things fail and the patients don't respond to these medical methods, then only they are considered for surgery.
Fair.
So probably just about 10% of my patients with a back problem may end up on my table.
Fair. When you say degenerative, the thing I understand from that is that it happens over time. So not the young crowd, but more senior citizens, middle age, all of that. But I'm hearing of kids needing neurosurgery. Why does that even happen?
Okay. So pediatric neurosurgery is more of disorders of birth itself, involving the birth, involving the brain and the spine. And they also have acquired tumors. So there are childhood tumors which may be cancer quite often.
Okay.
So they form the basket of the pediatric neurosurgeries we operate.
Okay. And when we say brain surgery, and maybe some of this comes from the movies, but it's almost, life-defining and death-defying. It's the most crucial, most difficult form of surgery. I'm sure it was that at some point. But tell me about the medical advancements, and should I be worrying about brain surgery as much as somebody did 15, 20 years ago?
See, of course, brain is, I can say that the most important organ in the body.
Fair.
It cannot be transplanted or replaced.
Yes.
And it is what makes you what you are. So
Yes.
you are Jagu because of your brain. I
Fair.
am Vishwanath because of my brain.
Fair.
So the brain carries a special importance in the body.
Yes.
Definitely, surgeries for the brain have advanced a lot in the last 30, 40 years. The risks have gone down a lot. The deaths because of brain surgery or other following death surgery
Hmm.
are also extremely low nowadays.
Hmm.
And this is because of the, it's like a symphony orchestra between technological advances and the theater team.
Yes.
So technological advances have made a big difference to uh, brain surgery nowadays.
So, doctor, you mentioned technological advances, and that's something I want to explore a little further. But tell me about AI. Everybody's talking about AI being involved with every sphere of life. Is that true for the medical fraternity? Does it help? Does it hinder?
I think in the journey of neurosurgery, I'll keep AI probably as my next kind of answer to you. And I'll
Okay.
go back a little bit to why neurosurgery is more good results now. It started with
Yes.
an improvement in diagnostics, you know. So probably 40, 50 years back, there was no scans. So to even
Yes.
pinpoint a location of the tumor
Hmm.
was extremely difficult. Now we
Yes.
have advanced CT scans and MRIs, which gives you the precise location of your tumor or the
Hmm.
problem per se,
Hmm.
and the treatment can be tailor made to that problem itself.
Okay.
So that is one big development in neurosurgery.
So you know what you're going into
Before
versus
you even,
okay.
yeah,
Okay. And that helps.
that
Does
helps.
does that help in minimally invasive surgeries also, that you know what to pinpoint and therefore you're going there, or is that a whole different subject? I basically want to know, as far as brain and spine is concerned, what does minimally invasive mean?
Fine.
I would rather nobody went to my brain, but if one has to, minimal is a good word to use.
Okay, I'll tell you. I mean, the technology which you are very curious about. So one big advancement which happened was imaging, which
Sure.
first that's the main thing to know where is your problem. So
Okay.
that's an important. It's like a
Okay.
Google map of your brain.
Fair.
Yeah. Second advances happened in anesthesia. So
Okay.
now we can give anesthesia to 80, 90-year-old, 100-year-olds with medical problems and be almost sure that they will not have any anesthesia related problems.
Okay.
And third, we have amazing adjuncts in our operation theater. If you ever, I mean, I hope you don't, but if you ever have to visit an operation theater of neurosurgery anywhere in a good big hospital, it'll have big machines. So we have operating microscope to give you illumination, magnification when you're operating. We have endoscopic systems to again help you guide your surgery. We have something called navigation,
Hmm.
which will exactly tell you where is your tumor when you're operating.
Hmm.
So now it's like a synergy of a
Hmm.
lot of technological advances and the neurosurgeon and the whole team in the OT,
Hmm.
and that's what produces the end good result.
And this is the orchestra you're talking, right? The team is there. It has technology to assist it that was simply not there maybe even 5 or 10 years ago.
Maybe 20, 30 years. Yeah.
Fair.
Yeah.
Okay. Uh, Putting all of this together, what does this mean for recovery of the patient? Are the words better and faster relevant here?
See, it's a very unusual thing. Minimal access surgery. You know, whenever the patient comes to a clinic, or rather, when I know every week I get a patient who says, uh, "Kitna taka lagega?" or
Ah,
"How many stitches will I have?"
yes.
And I have this very old kind of a story from my childhood which says that if you hang out a cloth for hanging for how much time will it take to hang,
Huh.
and if you hang 10 clothes, how much time it will take.
Yeah.
So it used to be a big riddle in our times, and
Huh.
the answer is of course the same time.
Fair enough.
So
Yeah.
it doesn't matter whether you are given one stitch or they are given 20 stitches.
Hmm.
It's going to take you the same time for the stitches to heal. So
Fair.
minimal access doesn't really mean how many stitches on the skin.
Hmm.
It means the shortest, smoothest, safest corridor to reach the area in your brain or spine
Okay.
which has got the problem,
Okay.
in such a way that we tackle only the problem,
Hmm.
and most often we don't even touch your normal brain or spine.
Okay.
So that
Excellent.
is the technical meaning of minimal access.
Okay. And then recovery takes the time that it does.
Recovery takes the time it does, but the recovery is definitely faster,
Hmm.
mainly because the pain is much lesser.
Ah.
So, especially in spine, if the
Hmm.
pain is much lesser, we allow our patients to walk on the same day after surgery.
Wow.
Probably
Okay.
second day or third day he's gone home.
Okay.
And if the patient is really good motivated, he can
Hmm.
go back to work in 2 weeks' time.
Wow.
So, shorter recovery is also a very important, adjunct to minimal access surgery.
Fair enough. Let me shift this to tumors and literally the colloquialisms behind it. when one hears tumor, one assumes cancer. That's not necessarily true, is it?
Tumor in medical language just means a swelling.
Okay.
That's it.
Okay.
So the swelling could be just normal swelling.
Hmm.
It could be benign or rather non-malignant, non-cancer swelling, or it could be a cancer.
Okay.
So tumor is just like it's like made to believe a bad word, but it's not necessarily so.
So if it's non-malignant, if it's benign, malignant or benign, or however one chooses to address it, and I'm glad for the comparison of tumor and swelling. Let's not make too big a deal out of something that isn't necessarily a big deal. But now suddenly we have a range. How do you decide within that range what one should operate on and what one should not?
Most brain surgeries, whether they are non-cancerous, benign, or they're cancerous, malignant, will need surgery. Okay. So the choice of the surgery depends upon the condition of the patient when he comes to you, and of course the imaging.
Sure.
So you have good MRI scans with you, and depending upon these two things, the clinical condition of the patient and the scans, we decide which patient needs surgery.
Okay.
But most brain tumors will need some sort of a surgical intervention.
Okay. Now, here's the thing. You can only decide these things when the patient comes to you. Now, the patient could come to you early, could come to you late stage. What are these early warning signs one should look for to realize this is a little out of the ordinary from a tumor point of view?
Okay. So brain tumors generally, again, I'll come to the common symptom of headache.
Okay.
So unusual headaches, not responding. Second, fits or rather involuntary movements of any part of your body.
I see.
Weakness of maybe the right side or the left side.
Okay.
Any facial asymmetry which you may develop. And, sleepiness or rather dullness or over fatigue. So these things are probably important signs to, consider the backdrop of a brain tumor or something.
Okay, fair. Let me look at that is a long-term thing that one applies their mind to. Am I feeling this? Am I feeling that?
Yeah.
But I remember you also discussed emergencies. A lot of your cases that come to you by virtue of emergencies.
Yeah.
What is this golden period, golden hour thing that one has to look out for? What is that about?
Okay. So the brain is very blood supply. That means oxygen and glucose dependent.
Sure.
So even if a minute there's a stoppage of the blood supply to the brain, 1.9 million of your brain cells will die.
Oh.
So that is when this concept of golden hour came for brain treatment.
Okay.
More to do with stroke. So basically a stroke means a stoppage of the blood supply in your brain.
Fair. Okay.
Most often,
Okay.
So that is when this golden hour period and early institution of treatment has come up.
Okay. And so we discussed early warning signs in terms of
tumors
over a period of time. For this in particular, I mean, I don't want to wait till a collapse has happened and things like that. Yeah. What am I looking for? Because some of those early warning signs, like fatigue, for example, I could just be tired. I don't want to be a hypochondriac about it. But are there any signals? And I realize this is subjective. I realize it's difficult to answer. And I realize there is no one quantitative answer. But something that I should look out for?
See, for chronic problems like a brain tumor, if you're asking me, then again I'll go to unresponding or rather non-responding headaches, tingling, seizures or fit kind of movements, weakness of one part of the body over a period of few days to few weeks.
Okay.
These are pointing towards probably something wrong in the brain.
Okay.
The second point which you wanted to ask about was stroke and this golden hour.
Yes.
So in stroke, there is something called, if you remember the mnemonic, FAST or rather fast.
Okay.
So you ask somebody, you see his face. If there's an asymmetry in the face, that becomes F.
Okay.
A is arm.
Okay.
You ask him to lift his arms.
Okay.
If he's unable to lift one arm or if there's a fall of one arm,
I see.
that means there is probably a stroke.
Okay.
S stands for speech. So you ask him a few pointed questions. Okay, what's your name? Where do you live? What do you work for? So if he's able to, or they're not able to speak or understand, or if there is a slurring in his voice, that again pointing towards stroke.
Okay.
And the T in fast stands for time. That means there's no time. He needs to be rushed to a good big center with a stroke facility and all imaging available. Okay. So stroke in short means a sudden loss of function
Hmm.
of any part of your body.
Okay.
And if that happens, you must assume it is stroke unless the doctor tells you otherwise.
Fair enough. Okay. Better to be safe than sorry.
Yeah.
And that's interesting. The acronym FAST: face, arm, speech, and time.
Yes.
Okay.
Perfect.
Something to keep in mind.
Perfect.
Absolutely right. Where I want to talk about, we're going back to age and recovery. Is it fair to assume a younger person recovers faster, or is that not necessarily true?
Anecdotally, in the last 6 months, I've operated a few 95-year-olds.
Wow.
2 years back, I operated one 103-year-old freedom fighter.
Wow.
His children were 80 plus years old when I operated him.
Okay.
So nowadays, I really don't believe in this age criteria as a defining border between whom to operate, not to operate.
Okay.
And now we are having a country with increasing longevity, survival, and there are more medical systems available to everyone. So I think we should not be defining medical results by age alone.
Okay.
Yeah.
Fair.
So what matters is, again, the presentation at the time he comes to me, how he is, what is his physiological age, how motivated the patient is to undergo the treatment and the surgery if required. And I think these are more defining factors to outcomes rather than only young.
Okay, fair. Fully appreciated. Let me then come to post-surgery recovery time. Is there a thumb rule?
There is no thumb rule, precisely because in brain and spine there is a huge variety of tumors, locations of tumors. Certain tumors recover very fast because they are probably in a so-called not very important part of the brain. But certain tumors which are deep-seated in important locations, they may take much more time to recover.
Okay.
So recovery is not very fixed diagnosis based. But in short, nowadays the recovery days are much faster than it used to be maybe 20-25 years ago.
Okay.
So most of the spine patients will go home walking in 2 days time. Most of the brain tumors also operated will probably go home on day 3 or day 4.
Not bad. Okay.
So most often. So this is what we see nowadays with minimal access surgery. And the most important contribution is not only the surgery, the contribution from physiotherapy, occupational therapy, speech therapy, rehabilitation. So these all contribute to the patient's recovery and to a quicker return to a functional life.
No, fair. That whole thing about family support, and just because you have left the hospital walking, even then, that is not the end of the treatment. There's that much more to do.
I think it's important for the surgeon to convey to the patient and to the family what are their contributions to the treatment outcomes.
Okay.
So generally what happens in my clinic is that, I answer questions about where is the tumor, what we'll do, what is my plan, but I always try to add what their plan should be.
Yes.
So it is very important for the patient to know, I'm going to be in the ICU for a day. Then I'm going to be in the ward for 3 days. Then I'm going to go home. I'm going to be starting physiotherapy on day 1 itself. So if they are prepared for it before they agree to the surgery, their outcomes are better.
Fair.
And the family also has to be, motivated enough to support the patient for at least like a 2 weeks or so. In today's time with less manpower at home, they must be, if they can't do it themselves, then they may need to arrange some help at home or nursing help at home. So these things are better planned, prior to the surgery than at the last moment,
And at that point, information and knowledge is important.
It is extremely important. So motivated patient, a supported family. These two things are a boon for a neurosurgeon, because they really define our outcomes.
There is this fear that I won't be normal after brain surgery. Again, this is fed from more colloquialisms and reputations more than actual fact. But explain, what can one expect 100% normalcy after a surgery, even if the surgery is complicated?
See, that again, brain surgery, if a patient comes to me with a bad road accident or a huge stroke or a big bleed in the brain, of course his recovery and his back to normalcy will not be there for maybe months. And of course, unfortunately, many patients never go back to a good, meaningful life. Okay. But if you're talking about planned elective cases like tumors, which you already know what you are going to do, and if they are non-malignant, then a return to a full functional life is very common.
Fair.
In fact, I've had patients of mine, going back to a full physical active life also. Like, just 2 weeks back, I saw an Insta post of one of my patients who's back to trekking and climbing hills and mountains after brain treatment.
Oh.
So it's very common. And now patients go back. I mean, that's what they ask. So, doctor, when can I start running again? When can I start cycling again?
I have never asked that question. When can I start running again? It's been a long time since that ever happened.
So patients now also want to go back to a full normal functional life.
Of course.
So that demand is met with modern surgery.
And that again boils down to what you said, a motivated patient.
A fit body makes you recover also faster.
That's true. No, that's 100% true. So let me conclude this by a couple of rapid fire questions, also to bust some myths that will help us. So humor me while I do this with you. Do all fainting spells mean that there is something wrong with the brain?
See, fainting is a huge sort of a network. It could be something as simple as low sugar, low blood pressure, or it could be something really serious like a heart rhythm problem or brain issue.
Sure.
So repeated fainting episodes need investigation.
Fair. Is it true that brain cells never regenerate once they're lost?
So there is something called neuroplasticity.
Okay.
Where even if your cells don't regenerate, your existing cells can be taught to do new things.
Okay.
And that is what neurorehabilitation is all about.
Can stress and anxiety trigger seizures?
There are something called panic seizures. Okay. And more importantly, stress and anxiety can give you a high blood pressure, high cortisol levels, and they can contribute to a bleed in the brain or a stroke.
Okay.
So indirectly, definitely stroke and anxiety are related.
And do all people with seizures, are they then diagnosed with epilepsy?
Seizure is more often maybe a day, a once episode kind of thing.
Okay.
It could be just something very simple like some metabolic problems or some low salt or low sodium in your blood.
Okay.
Epilepsy is a definition more for repeated episodes of seizures.
Okay.
Which generally need a long-term medical care.
Fair. If somebody has constant or regular dizziness, does that automatically indicate a brain problem?
Most often, dizziness is related to the ear or the balancing system in the ear. Okay. But a dizziness which is not responding, of course, needs a full comprehensive team approach to diagnose. So you may need a neurologist, neurosurgeon. You may need an ENT specialist to make the diagnosis. So it is not only related to brain. You must evaluate the other systems of the body also.
Okay, which involves multiple medical tests to get to the right answer.
Yeah.
Okay. Lifestyle changes alone, can they prevent the need for brain or spine surgery?
Okay, I'll go to spine because it's more lifestyle related.
Okay.
Yeah, I think simple things like posture, core strengthening, flexibility for your spine, daily exercises, all these things can, most often prevent degenerative spine problems from happening.
Okay.
Yeah. And in the brain, again, things like, maintaining your BP well, a good non-fatty diet, daily exercise at least 4 to 5 times a week, an active, good lifestyle will prevent you from problems like stroke, bleed in the brain.
Fair.
There are still no direct relationship of tumors and lifestyle, but I'm sure with time, with more research, there will be something in that direction also.
Fair. Let me conclude this, Dr. Iyer, by asking you, for our listeners and viewers, the top 3 things one can do, like without outside medical physiotherapy assistance, to just maintain a healthy brain and spine.
I think the top 3 things, and I elaborate each of them. 1, keep yourself physically active.
Okay.
2nd, keep yourself mentally active. And 3rd and most ignored point, sleep well.
Please elaborate on the sleep well.
So I'll go to the first one,
Okay.
Jagu. Physical, to keep yourself physically active. So when if you do at least moderate level intensity exercises for 4 to 5 times a week, it improves the blood supply, oxygen to your brain. And that, improves your cognition, your mental ability, and your ability to be productive for many more years in your life. So there is a direct link of physical activity and a longer mental ability.
is it fair to assume 45 to 60 minutes of walking at a faster pace than you usually do 4 to 5 times a week is?
That categorizes into moderate intensity workout,
Okay.
and that is enough.
Okay. Fair.
Second is to keep your brain mentally pushed or challenged. So as you become senior, incorporating certain things like reading, solving a crossword probably daily, or even the Sudoku, which has become a big thing now.
It has, yes.
These are important things. Maintaining a good social network, a friends network has been shown now to have great benefits in your longevity and a healthy longevity.
Fair.
And the third, sleep. And this has become a challenge now because of the shift in our diurnal rhythm.
So I'm going to segregate sleep and sleep well. You use the term sleep well, and I would very much like you to explain the difference.
In short, 7 to 9 hours of sleep quantity-wise is what is recommended.
Okay.
Quality-wise, it may differ from people to people.
Okay.
Somebody may be okay with just 5 hours of sleeping, and somebody may need more than 9 hours. So that is left to individual choice. But the sleep is very much defined by how, or rather the quality.
Yes.
And now we are focusing too much on the devices to tell us, are we sleeping well?
That sometimes causes more stress.
I think if you really look at your device reading every day and go to analyze that, you may sleep less fitfully.
Wow. Okay.
So I feel, certain few things like avoiding social media or any sort of blue screen for 1 hour before you sleep.
Okay.
Maintaining a proper pattern. See, the sun comes in the morning, sets in the evening, and the body is supposed to follow the sun. So if you are able to system your biological clock along with the sun, it may help you to sleep in a much more fitful way.
Fair enough.
But nowadays we see most people are awake till midnight. They wake up at 8, 9 plus. So that is definitely going to affect your body clock.
Okay.
And that reduces the quality of your sleep.
Now, you actually wake up and cycle every morning. Is that, I hear that. And so tell me how it works for you, because as a doctor, as a surgeon, high pressure job, long hours, tell us how you manage it. Let me use that as a template, because if a doctor can sleep well and get up in the morning, cycle, then go to work, then the rest of us have no excuse.
I'll give you the answer in the reverse way.
Okay.
Probably because I'm getting up in the morning, because I'm exercising every day, I'm able to live a productive neurosurgery life and also give good enough time to my own personal, challenges or whatever you may say. So, it all started the very wrong way. I came back from abroad to Bombay, and the first couple of years I was so much involved in work that I did not do anything for my fitness. Started getting low back pain, problems. And then somebody said, just start cycling. Okay. So it's been more than 14 years now I've been cycling regularly.
Wow.
And touch wood, there have been no, back pains or neck pains since I started cycling.
Okay.
So I'm not only going to stick to cycling. I would advise everybody to choose your own, passion, whatever it is. A simple active walking, jogging, running, cycling, swimming, gym, anything. But it has to be a consistent effort. And it has to give you happiness also.
Yes.
So don't take exercise as a punishment which you have to do every day.
Fair.
Unless an exercise keeps you motivated and happy that, okay, I want to get up and do it. That's when you will maintain it for many years.
Absolutely.
So, and it will really improve your quality of life and your productivity. I think we should not take it out as, okay, I'm taking out 1 hour. That 1 hour is going to, in fact, enhance your day.
Absolutely. And my life.
Sure.
It could probably buy me a decade.
Okay, this is also a little difficult to answer, Jagu. Okay. I think, again, we should be exercising probably to live actively and for longer. But I think it's more important to not focus on the length or rather of your life.
Quality.
It's better that you are active and happy till you are alive.
Yes.
And exercising will keep you that way.
Fair enough. No, I appreciate that input. I actually appreciate a lot of the input. So much of it is new. So much of it is a learning in the course of this podcast.
Thank you.
Dr. Iyer, thank you so much for doing this with us, taking out the time and enlightening us. Much appreciated.
Thank you so much. Thank you, Jagu. Thank you.
And that's a wrap on today's episode of the Good Doctors podcast. Remember, not every ache or symptom is a disaster, and the right advice at the right time makes all the difference. A big thanks to Dr. Vishwanathan Iyer for breaking it down so simply. I'm Jagu. Thanks for tuning in. Catch you in the next episode. In the heart of Mumbai stands a name trusted by thousands. Over 1 lakh heart procedures, 200 plus years of combined experience. From diagnosis to recovery, your heart gets complete care under one roof. Because when it comes to your heart, experience isn't optional, it's everything. Zynova Shalby Hospitals. Experience you can trust, care that you deserve.